Welcome to the Dr. Lexi Show, where I take pregnancy topics and break them down as simply as I can to help you advocate for yourself and your pregnancy. I'm Dr. Lexi, a board-certified OBGYN and maternal fetal medicine specialist, which just means a high-risk pregnancy doctor. And today, we are not only recording a little bit for visiting more about pregnancy items, but we have a wonderful guest for you today for our podcast. Today, we've got Tim Dunlap visiting us. How are you today?
I'm doing great, Lexi. Thanks.
Good. I'm so glad you're here today. So this is a really, really fun guest today because I am going to let you, Tim, describe to me what you do and your title, because I think you will describe it better than me. But I just wait for it, guys, because this is so cool. Okay, go.
All right. Well, I'm the Director of Medical Sales at Globiotics. And my role, I work with a lot of the physicians that carry our line, working with different international distributors that work with the Globiotics range of products. And I've gotten really to get my hands wet in all different types of elements of the business. So from everything from actual patient questions about like, hey, is this product safe? And just overall positioning for a lot of our physicians that offer the line to really target anti-inflammation and using topical probiotics. So there's a lot of cool science behind it. I know we'll jump into some of that, but my role within the organization is all about the medical side of the market and working with our industry professionals like yourself.
Nice. And can you give us a little bit of a background as to what your background is when you got here, as far as like your, I guess, education, right? Like what you did that got you to what you're doing now.
Yeah, well, I went to school for environmental science. So it's not really in the skincare world, but a little bit of science in there. Yeah. But I came on board with Globiotics about 12 years ago, almost 12 years ago, working in specifically managing the customer service department. So working with a lot of the physicians that were carrying the line and working with the different reps in the field that were positioning the products to be out there. And then I kind of moved from the managing the customer service side into more sales management and working in territories that didn't have like local sales reps to help present their products and teach people about how to sell them and bring into new offices.
Nice.
And then, pretty much went from there. Now I'm helping to really help with our outside sales reps that work with the line and also all of our doctors and distributors. So it's really all the whole medical side of the business. So more of the questions for professionals and a little less direct consumer kind of side of the program.
Yeah. So we're going to try to simplify some of this stuff because as a provider and dealing with pregnant individuals, I sometimes get questions that I cannot answer. And I think that this is a space, like it's not super medical. And in my field, like it's not, tell me about the pregnancy. It's kind of like a little bit in the derm world, right? Which is not in my training, but it's a space where I think people are going online a lot and looking into social media and just Googling. And so my goal today is to provide information, not only on your product, because you'll have a great story that I want you to share as far as the safety behind it and kind of where it came from. But when people ask me what they can or cannot do or should not do in a pregnancy for skincare, it's a place where a lot of providers in the obstetrical world are not comfortable talking about it. And that's why I kind of wanted to bring about your knowledge, your brain, and then side note, your product, because I just think it has a really cool safety profile, I guess you could say, behind it for people that would be my patient population. So I'm excited about that.
Nice.
Okay. Now, before we get into this, I have questions for you that you did not know I was going to ask.
All right. On the spot.
Yes. There are 10 questions and then there are 10 true false. And we'll go through them pretty quickly. And it's just to see across the board people's knowledge about some things pregnancy, because I want anybody watching or listening to understand that we don't know what we don't know, right? And there's a lot of stuff. Don't be ashamed or scared, or don't be nervous to ask a question, because a lot of things we just don't know, right? Okay. Are you ready?
I'm ready.
All right. Question number 1. What does the abbreviation OBGYN mean?
Obstetrics and gynecology.
That's fantastic. Yeah, that's correct. I have to ask you, do you have kids?
I do.
You do? Okay. So you've been through the appointments and stuff like that a little bit. So
I have. And number 2 is high risk. So maybe I'll get more of these. I don't know.
Okay. All right. There we go. All right. Question number 2. What do the letters MFM stand for?
Pass.
It's okay. You know that I'm an MFM, right? Does this help? Does that help at all?
I was just going to go. No,
That's okay.
I don't want to say the wrong thing.
That's okay.
Here.
Maternal fetal medicine. Yep.
Makes sense.
Yeah. It's kind of weird to have like IM like 3 letters as opposed to like a long name to it. But yeah, that's what I do. Yeah, I know. So if you have a high risk pregnancy or y'all had a high risk pregnancy, you might have seen a maternal fetal medicine specialist, which they sometimes just call a high risk pregnancy doctor.
Got it. Hey, makes sense.
There you go. All right. Question number 3. How does a provider come up with the due date during pregnancy?
Due date during pregnancy. Okay. I think that would be based on the date of the last menstrual cycle.
That's so good. Yes. They start with that and then they do an ultrasound and see if it jives. Perfect. Fantastic. You're crushing this. All right. Question number 4. When is a pregnancy considered term?
Based on the weeks of gestation.
Yeah. Yeah. How many weeks would be term, you think?
56. No, I don't remember.
That's okay. So 40 weeks is when the due date is. So then 37 weeks and beyond is considered a form of term. Yeah, you're doing great. This is fantastic. All right. Question number 5. What is the normal fetal heart rate?
140.
Fantastic. Yeah. 110 to 160. Yeah. So 140 is perfect. Fantastic. All right. Question number 6. What is antenatal testing or fetal well-being testing? Have you heard of that term before?
Fetal well-being testing. I mean, I'm thinking like things like amniocentesis maybe, or like some sort of measure of fetal health before the pregnancy comes to term, would be my guess. But
so fetal well-being testing or antenatal testing it's well-being, right? Checking how the baby is. And you can do it either with those belts that they put around people whenever they're in labor to watch the heart rate. It's either an outpatient visit of that, or they'll do a quick ultrasound to check for the baby's practice breathing, the movements, the tone of the muscles, and the amniotic fluid. So it's like a quick check, usually in the 3rd trimester. So
usually non-invasive.
Usually non-invasive. Yep. Mm-hmm. Yep. All right. Question number 7. How does an ultrasound estimate the weight of a fetus? Maths. Yes.
No, I would go
I do like how you said maths, though, because that's like a British thing to say, like maths. Yeah.
I would think probably take the approximate length of the fetal body and apply some sort of a formula, be my guess.
That's a very good answer. Kind of, and yes, the lengths of the bones. So we do an arm bone, a leg bone around the head, side to side of the head, and then around the belly, and then put it into a formula. Yeah. Now, when you say the length of a baby, here's what's funny. After 14 weeks gestation, we never measure the length of the baby again. Like not from head to toe type thing, because they're so scrunched up.
Yeah. After I said that, I was like, how would you even measure that anyway?
But a lot of people ask me when we're doing, let's say they're 32 weeks along and we're checking how much the baby weighs, they'll ask how long the baby is. And I have to kind of remind them that we don't look at length, like head to toe length. We will measure bones, but we can't measure the height or the length of the baby after 14 weeks.
Extrapolations only.
That's right. That's right. All right. Question number 8. What makes up amniotic fluid?
Got to be a healthy dose of cytoplasm in there. I have no. That one is one that I'm afraid I do not know.
No. What if I said fluid? Baby pee? Does that seem right?
That sounds pretty right. I'm sure there's lots of that in there.
It's urine. It's fetal urine. Yeah. Very good. Question number 9. Who should be offered Down syndrome screening in a pregnancy?
Mothers. I think it's above a certain age range. Maybe that would be an option more. Maybe over just like a advanced maternal age.
I love that you know that term. It's great. Everybody should be offered Down syndrome screening. All right. Final question here. Question number 10. What is considered a normal length of a cervix in pregnancy?
In pregnancy, during dilation stages, you're going many centimeters. So I think probably half an inch to an inch, maybe during pregnancy.
So
maybe less.
The length of it. Length. Yeah. Because your dilation, you're right. It gets up to 10 centimeters.
I'm going to go length. Okay. This is going to be 1 inch. Final answer.
It's 3 centimeters. So, I mean,
that's an inch.
That's not that bad. I mean, that's like, I can't convert and do math in my head. Does anybody know So it's like an inch and a half or something.
3 dimes or so.
Yeah, so that's not
10.
off that much.
Yeah, a little more than an inch and a quarter.
But it does get shorter and then start to dilate, right? You just don't want it to shorten and or dilate before labor. That's bad. That's, you can't keep a pregnancy in if that happens. So very good job. All right. And that's kind of a trick question too, because it's different at different times. But the general rule of thumb is between the 16 to 24 week mark where we measure it. We would love for it to be above 3 centimeters, definitely above 2.5 centimeters.
Right on. Well, probably less of a chance of an early water breaking kind of thing.
More for labor. We can't predict the water breaking, but the labor part, yes. And sometimes the labor and the water breaking goes together. So yes, your brain is very scientific. I really like it. All right. So these are going to be 10 true, false questions. And all you have to give is a true or false. All right. Question number 1, true, false. A fetus can have hair in the womb.
True.
Very good. Question number 2, true or false. A fetus can hear.
True.
True. After 25 weeks. Very good. They have acoustic stimulation, right? It's more the vibrations, but yes. Question number 3, true or false. If a pregnant individual eats sugar, this will wake a fetus up if they're sleepy.
False.
I go false. And most people I feel like say false because that's not going to do it. Like if they're asleep, you can try to give them acoustic stimulation, like a vibration. So they'll hear and then they'll kind of like wake up a little bit. And in fact, I read a study recently that said if the mom's glucose level is up, and it doesn't mean like really high, but like it's not low, like it's up a little bit, between a certain gestation, the babies would move more, and the other times they would move the same or less, which doesn't really, that's weird to me. Like that doesn't seem to correlate. So I just think my thing is it probably doesn't make any difference. And that's why they showed sometimes this, sometimes that. Anyway, it's just my way of looking and extrapolating that data. All right, true or false question number 4. Everyone should be screened for diabetes when pregnant.
True.
Correct. True or false question number 5. Everyone should be screened for thyroid disorder when pregnant.
I'd go true.
That one's going to be false. I know that's a hard one. And a lot of people do screen for it, but they're not supposed to. And they're kind of catching people in a weird spot because the thyroid hormones do change a little bit in pregnancy. So
false alarms.
Exactly. A lot of kind of extra screening that doesn't need to be done, increasing anxiety in patients, tests that don't need to be ordered, and then follow-up tests, and then. So yeah, one of those things that happens a lot, but shouldn't be happening as of right now. Yep. All right. Question number 6, true or false. Someone with 2 prior cesareans has to have a 3rd cesarean.
I think that's true.
So not now. It used to be. So we used to say if you had 2 prior C-sections, we were too nervous about the uterus, rupturing or opening that you would need a 3rd. And now some data says, well, if you've had 2, you can still go ahead and try to have a vaginal birth after that because the risk is not substantially higher. Now, if you've had 3, then you have to have the repeat C-section. I know. Data changing all the time. But you were correct as of like a few years back.
All right. Hey, came from somewhere.
I know, right? All right. Question number 7, true or false. Twins that are the same gender are always considered identical.
False.
That is correct. Very good. All right. Question number 8, true or false. No cheese is safe to eat while pregnant.
Oh boy, that's rough. I'm going to go false because I really don't want that to be true.
You are correct. You just need to have cheese that is pasteurized. Yeah. Because otherwise you could get listeriosis, food poisoning type thing. Question number 9, true or false. Someone trying to get pregnant should start taking folic acid before pregnancy.
That's a pretty big element in prenatal vitamins.
So funny. I just did a little YouTube on prenatal vitamins and you'd be surprised they're supposed to have a certain amount of folic acid in them.
Well, but I'm going to go with yes, but depends on the amount of folic acid. I know you don't have a ton of iron, I guess, beforehand because I know that can cause other issues. You ideally should have folic acid 1 to 3 months, at minimum 1, and then up to like 3 months prior to pregnancy because it helps to prevent neural tube defects like spina bifida and stuff like that. And most prenatal vitamins should have enough of it in them, but every prenatal vitamin is a little different. So
So yeah, if the prenatal vitamin has enough in it, that's enough to take it to that level. But if you're not taking the prenatal vitamin before you get pregnant, then it's meant to be started before. Yeah.
Interesting.
All right. Last one, true or false? Question number 10. Baby aspirin is an over-the-counter medication that can prevent a certain type of high blood pressure during pregnancy.
True.
Yeah. 81 milligrams of baby aspirin has been shown to decrease the risk of preeclampsia, particularly in certain people that have risk factors like prior history of preeclampsia, or they themselves have high blood pressure, or they have diabetes and stuff like that. Just a tiny little baby aspirin.
Huh. I think I remember you mentioning baby aspirin in some other conversation months ago.
Really?
So I'm pretty sure that's where I got my true.
All right. Well, so if you are comfortable too, just before we jump into some skincare stuff too, you said 2 kids, right?
2 kids.
And one was high risk. Do you remember what was high risk about it?
It was deemed high risk just because of mom's age.
Okay. So that's why you know the term advanced maternal age.
Yes, we hated, or she hated that term especially. but yeah, so that was the only reason.
Got it.
But yeah, we healthy little boy, turned
Good.
6.
There we go. I love it. Now, so do you remember then the definition of advanced maternal age? How old does someone have to be for us to be labeled geriatric?
I want to say 32 or 33.
35.
35?
Yeah. Now, here's the counter question. How old does a dude have to be labeled advanced paternal age?
Trick question. Doesn't exist. No, maybe it doesn't. 74.
Oh, my gosh. No, it's like some people say 45, some will say 50. You might even hear 55 here and there, but it's usually right around 50. So, and fun fact, it's not associated with as many things, I would say, as maternal age would be, but there can be, fun word here, craniosynostosis. That's one thing where the skull doesn't form well. And then, and I want to say achondroplasia too, which is dwarfism, certain type of dwarfism, but neither here nor there. Okay. So now in pregnancy, tons of changes that individuals have. And one of them I know is some people are oily, some people are dry, all these kinds of changes. And a big one, the melanocytes increase. So people can have, like, they call it the mask of pregnancy, kind of a little darker skin tone, stuff like that. So I'd like to try to go into this in 2 different areas. Kind of one, basic everyday skincare, washes, like just, the people that have a prior skincare regimen that they have no idea if it's safe to use when they're pregnant for just daily skincare stuff. And then the second, I would love to go into more of like true acne and maybe some of those things just for thoughts. But for a daily kind of like skincare wash and stuff like that, I know from my standpoint that I don't want people to be on retinoids or anything that has a vitamin A component to it. So that's my introduction to tell me your thoughts and what you guys have, because I know that when I've looked online, y'all do have products that are specific for pregnant individuals. And so I want somebody watching or listening to understand, what does it mean for something to kind of be quote unquote pregnancy safe for a skincare product?
So for our brand and our kind of positioning in the medical space is when we were first developed and we were looking at different formulations and what kind of ingredients to use and whatnot, one of the thoughts at that time was, let's launch a product line that was going to be safe during pregnancy, safe for compromised immune systems. And so a lot of the no ingredients we've been really avoiding from the start because of that, but also to do with compromised immune conditions like cancer in the family or history of cancer. There's certain kinds of ingredients like hormone disruptors and xenoestrogens or parabens that are, they're no ingredients we want to avoid. So certainly you want to first and foremost look for a product with no parabens, no xenoestrogens or hormone disruptors, and then certain kinds of certain chemicals that are in skincare products. Retinol is certainly the most common, I guess, is a no ingredient to avoid. Retinol and different derivatives of retinol, because it can have a lot of different names. But really the biggest piece is just to avoid anything retinol or retinol related, along with just using products that are going to be as anti-inflammatory as possible. You can still have good results without inflammation, but people are extra susceptible during pregnancy, and certainly the ingredient profile of the products to pick should fall in line with that. Yeah. But yeah, I mean, as far the main things though, I mean, I would tell you, this is one of the products that I've kind of brought. It's one of our components of the Soothing Essentials home treatment kit that we sell that has a couple of different products, but this is our probiotic revitalizing cleanser.
Mm-hmm.
So as far as like a first product to go to, daily cleanser, you want something gentle. This is some of the things that make it more unique. It's got no sodium lauryl sulfate or any sulfates, which are oftentimes used in skincare products as sudsing agents. So like pretty much any toothpaste or shaving cream, it'll always have sodium lauryl sulfate in it.
Shampoos have that too, don't they?
Yep, absolutely.
Okay.
So they're basically surfactants to help make bubbles and foam. So we don't have any of that in here because it can be non-drying. It can be drying.
Oh, drying.
So SLS and sulfates in general are drying for skincare, and that can lead to inflammation. So no sulfates in this one.
So, okay, you got to go back to the sudsing thing, because I know people that are like, they buy a face wash solely based on how much suds they get because they just like the latheriness. So anticipate that this would not have that much of a lather to it, right?
Well, actually, this does have a little bit of a lather, and there is, I guess I would consider it more of a cream type cleanser instead of a foaming cleanser.
Okay.
So it's not going to be super, super lathery, but you can definitely still get a good clean from it. It's one of the things you see with a lot of cleansers is they seem to be a little too aggressive, where people are over drying their skin, especially if they're cleansing twice a day.
Yeah.
So it's so being gentle is, I guess, the most important piece for that. Yeah, no sodium lauryl sulfates.
And it doesn't smell bad either. I've used these because I've had the opportunity to check some of these out, which I've loved all of them. I have very sensitive skin, and none of them have irritated me, and none of them have dried my skin out at all, which is weird because we also live in Arizona, so it's a very
pretty hot here,
dry spot. But it doesn't. I like how it smells too. It's not super anything really.
There is a little bit of a rose chamomile fragrance that's in this product. One of the things that's in all of our products is probiotics, topical probiotics. So we'll go over more of that, I'm sure, soon. But it's basically these probiotics that we're using. They're not always the best smelling ingredients. So sometimes we want to be able to use different kinds of rose chamomile fragrance as an example, just as some sort of a masking agent, just to make sure it still is a really luxurious skin feel and experience when you're using it.
Yeah.
But yes, so probiotics are a big piece of it, but light, gentle fragrance.
Yeah. And I think that was one of the big things is I've had a friend recently who was pregnant, and she brought me a huge bag. I should have brought it, but she brought me a huge bag full of all this stuff that she's like, I just can't use it anymore. And some of it, I think, was that she just didn't know if she could use it or not. And it's better safe than sorry, and just get rid of it. But then the question becomes, well, then what do I use, right? And I think that that's the hardest part. Because even when I see a dermatologist and I ask them questions, oh, if I were pregnant, what would you recommend I use? I don't feel like they always have a great answer for me. Because the dermatologist defers to the OBGYN. The OBGYN defers to the dermatologist. And then one of those people defers to the high-risk obstetrician, right? And then I'm like, wait, but that's not a pregnancy thing. But I mean, what are you supposed to do when you're pregnant, and who's going to answer these questions, right? Like, that's where I feel like we're in a great space for this, because you are one of the best experts on this. And I've talked to a lot of people about this. Your scientific background and the way in which you're able to understand the products and know what you should and shouldn't use in pregnancy is exactly, and I cross-check everything with all the databases I have, because that's where I think my brain comes in, is like, what do I have access to make sure I can tell someone, that's listening or watching that you should or shouldn't use during pregnancy, right? And we're on the same page with this because we talked about this before and we're talking about it now. Okay, so washes and stuff, we know the things to kind of obviously not have for that. And then for daily treatment, I know that people, when not pregnant, a lot of things they want to use. Hyaluronic acid is one. The retinoids is another one. I'm trying to think of another. Vitamin C
is always big.
Is a big one. So for those things, obviously we're saying clearly to avoid any of the retinoids in any form. So that's clear, which you can usually find. I mean, they should be on every ingredient. And that's also the thing. If you have a product and you can't see the ingredients on it or it's not listed, don't use it. Right?
Better safe than sorry.
Better safe than sorry.
And there's a lot of other kind of ingredients that thankfully I don't have to look for too much because they're not in our products, but different kinds of parabens, and also like chemical sunscreens. That's another area that I've heard of people really wanting to avoid and just sticking to physical SPFs. And then one other piece is growth factors. There's a lot of growth factor type products on the market. A lot of them are derived from human or animal sources to actually get the different growth factor ingredients. And anything growth factor related is especially a sticky situation for those kinds of serums. So a lot of times if someone's pregnant or nursing, avoiding anything with growth factors, specifically foreign growth factors is important.
And would that be listed typically in ingredients as growth factor, or would it have a more complex name that we would need to look out for? That
a lot of times those product names would advertise growth factors. Usually you'll see it'll be actually specified as being a growth factor type product.
Okay.
So I mean, the question for your dermatologist would be just, does it contain human or animal growth factors?
Okay.
Or, I mean, our line, we use a growth factor stimulating peptides. So they're not actually from a human or an animal source, but they're peptides that stimulate our body's own growth factors.
Mm-hmm.
So it's a little safer alternative to that kind of thing. But you definitely want to watch out. No kind of foreign growth factors when trying to grow a baby.
Okay, there we go. Okay, so we've got the wash stuff we talked about too. And then if we were going with like a daily something, right? Like your middle of the road skincare for someone who is pregnant, or I'm going to just say pregnant or lactating. I'm going to kind of include that whole kind of area there. Would that be for products that you'll have? Would it be something that's the same day and night, just as a general like basic regimen?
So I would say for the most basic, like super simple, you want to cleanse every day. You want to use at least one serum, and then you want to hydrate, sunscreen. Those are kind of our basic 4 steps to start with. The product that I would suggest for anybody is the calming restorative treatment. This is the one that has our growth factor stimulating peptides in it. It's got hyaluronic acid for a little hydration. Mm-hmm. It's very, very gentle. This is going to be a kind of a soothing serum for people that it's just going to overall reduce inflammation and a little boost of hydration. Mm-hmm. So that's kind of if you want to have one product, definitely safe AM and PM. You could use it twice a day if you wanted to. Most people are probably going to use it just once per day.
Yeah.
But that's probably the main one that I would point people to first. Because the inflammation piece is so important for our brand, and especially for somebody that's pregnant or nursing, typically inflammation is going to be a piece of the puzzle to treat.
Yeah. And it does have face and neck too. So don't forget the neck. And then I didn't know this for years, that this is called your décolleté. Is that right?
Yeah.
Am I saying it right?
You got it.
One thing that people have a lot that I've seen in pregnancy, they get telangiectasias, which are these little red kind of, people almost call them spider veins, because they start as a red circle and they kind of like branch out like a spider's legs would, or like a spider web would. And you can know they're telangiectasias usually because they blanch. So if you push on them, it'll turn white. And when you take your finger away, it'll turn red again. And people can have a lot of those during pregnancy because of the hormonal changes. Typically after delivery, they will go away. Not always, but they typically do. So I think the redness portion is a lot. And what is it in the products or in products in general that helps with redness for the most part?
So the one ingredient that I like to highlight on this one, it's in several other products too, is called Common. It's derived from oat fractions. If you think of like a oatmeal bath for someone that's poison ivy exposure, it's an antihistamine, anti-redness ingredient. But basically, this Common we include that in this product and any of the soothing type products, as well as other kinds of formulations that might have people that are more prone to redness. So acne products and some of the anti-aging type products that have active ingredients that could be inflammatory. We want to have that calming ingredient from oats in there too.
Nice. Okay. I like that a lot. And I feel terrible for the people who get poison ivy, particularly during pregnancy. That's the worst. That would be terrible. Okay. So we have those. And then if we're looking at more for someone with acne, and I always assume, and this is probably not right, for people that have acne, that their skin is more oily. Is that typically
I think we certainly have dry skin acne cases too, but I think in general, more oil, more sebum, more acne.
And so for acne, there's plenty of safe items to use. And I kind of want to point out, you can go to a frequently asked questions link that I'll give you below that's gone through the American College of OBGYN, which is kind of the place I like to go to. I always tell people it's like our Bible in the world of OBGYN or obstetrics and gynecology. And they have a nice list of things that are okay and things that you should avoid, particularly for treatment of acne. So I'll put this up on the screen so y'all can kind of see all this as well. But any type of benzoyl peroxide is going to be okay in pregnancy in general for topical application. Salicylic acid, there's not a percent that's really included there, but that's something in general that would be okay for topical use. Glycolic acid and azelaic acid. Did I say that right?
Yep, azelaic. You got it.
Azelaic. See, I can't even pronounce some of these things. But those are going to be things that are going to be fine for use topically. And so do any of y'all's products have some of the salicylic acid and benzoyl peroxide or things like that that's more for acne?
So benzoyl peroxide is one, just to highlight, we don't have that in any of our formulas. And actually benzoyl peroxide, it is considered xenoestrogen, which
I didn't know that.
It's not, I mean, as far as topical use, that's one that a lot of people will still use for spot treatments. And I'm sure you don't have major issues getting into your blood with that. But as far as, that's one of the ones that we avoid though, for just because it is a xenoestrogen or hormone disruptor. The other ingredients you mentioned, 2% salicylic acid. We do use 2% sal in acne cleanser, acne clarifying and refining treatment. It's like a treatment serum, along with a couple of other products. But 2% is, from what I have understood, that's been the if a physician is going to recommend a salicylic containing product, 2% is pretty much the threshold you want to be at or under. But it's, some people as a general rule say salicylic, stay away from it altogether. So I think that's actually a disclaimer that we have on our products, at least on our website, buy the salicylic ingredient products. Just, you want to talk to your doctor first.
Yeah.
But
and all of these things for sure, or talk to your provider about trying to get a little bit more information on the things that you can bring up that you possibly could use. But any of these should be under the care of your provider. So if you're dealing with not just washes, but if you're dealing with acne at all, and you're doing anything topical or anything oral that they might be giving you an antibiotic or something that's separate or different, always talk to your provider about it before you start it. Or if you've been on it and you know you're pregnant, call them immediately and talk to them to see, hey, is it okay for me to take this current product? Can I continue it? Should I come in? And if you don't know, can you get me over to a dermatologist or an OB provider that can get me more information on it for sure?
Yeah. And I mean, that's a question that I get a lot because our whole brand is geared to be avoiding inflammatory responses and getting good clinical results. So people are always having pregnant or nursing individuals and they're at the table, they're in the chair. Hey, Tim, is this safe? This particular product, and 99% of the time it's fine. The cleanser is, I know we were talking about the cleansers, 2% salicylic acid, and that's not a lot. And most people do great with that product. Same with the serum. The other ingredients you mentioned, azelaic and lactic acids. We do use lactic in several products. 5% is the amount that's in like our instant resurfacing pads or layering solution. Those are great products that are pregnancy safe. And they also have a 1.2% azelaic or azalic. Two pronunciations, I think, are acceptable. Okay, good. I think for the record. All right. but yeah, those are that's also in some of our products as well.
Very cool. Very cool. And we had talked a while back because I was fascinated to hear about all this too, especially because xenoestrogens, I don't really know much about those, and I don't think most physicians do unless that's kind of their little forte. Can you give me a little bit more information as to what a xenoestrogen is?
So, broadly speaking, xenoestrogens by definition are just any ingredient that can affect hormone levels. Okay. So in very broad brush of that, but it's essentially most parabens or anything that's derived from petroleum typically are going to have xenoestrogen properties or be xenoestrogens themselves identified. Broadly speaking, looking at like the natural world, there's a lot more naturally derived ingredients that are not xenoestrogens, and some of the more synthetic kinds of, especially petroleums. Those are, and another place is phthalates. You'd see phthalates for a lot of plastics, and that can be also another source of xenoestrogens. I'm sure there's been topics you've probably discussed about different kinds of plastics contributing to phthalate level issues and potential fertility issues. That's another thing that I think there's been a lot more studies on, is phthalates affecting things, and definitely another kind of no product to avoid. But those phthalates are also xenoestrogens themselves. Okay.
And then for sunscreen, I wanted to jump over to sunscreen too. When you mentioned sunscreen, what is it about the sunscreen that we want to have in it in general? And then is there something, I know we had talked a little bit before about some fillers or something that a lot of people put in sunscreens.
Yeah. So when it comes to sunscreens, you've got two different kind of classifications. You can have a chemical block sunscreen or a physical block sunscreen. Physical is an actual shield where it's like an umbrella, mineral umbrella on your skin. It's going to block the sun's rays from ever contacting you.
Like when people are like blue and like really thick layer. Is that what you mean?
Well, yeah. I mean, if you think of like
or a true umbrella.
Sailors with their zinc paste.
Yeah.
With the white nose.
That's like
a physical block.
Okay.
We do use zinc in our SPF we only make one SPF. It is physical, zinc and titanium. But essentially, you're using minerals to actually shield your face from getting that radiation from the sun. The alternative chemical block sunscreens are using different kinds of chemicals like oxybenzoate or oxybenzone, I think is another one. Anything that says oxy in it is usually a derivative of some sort of chemical blocker. So if you look at the key ingredients on sunscreen bottles, oxybenzoate or derivatives, all chemical blocks, all xenoestrogens.
Oh.
And it's kind of scary how they work because like chemical block sunscreens, they take the radiation from the sun and disperse it through your skin and through your body. Instead of like reflecting it, it's like, okay, we're going to take this ray and then just shoot little gamma particles everywhere.
I did not know that.
Yeah, it's wild.
Okay, so oxy anything in a sunscreen is considered not the barrier, but more the chemical one.
Yep.
Would that be pretty much anything that's clear?
Or
not necessarily?
There are a lot of clear SPFs that use like micronized zinc and different kinds. That's kind of some of the newer technology is going to be, you can still achieve a transparent block with having just physical. But for the most part, it's going to be all chemical for most of those sheer type sunscreens. We do use in ours like a little pigment that makes it tinted. So there is a little slight tint, but it's just to cover the whiteness from the zinc. It's not to actually match a skin tone or anything like that. Mm-hmm. And I mean, I use it on myself and on my kids and you can't see it.
It doesn't look like makeup or something.
Yeah.
Okay. Because if you tell someone, I've told my significant other before, I'm like, it just has a little tint to it. And it's like what you're saying. But he's like, I don't want to look like I'm wearing makeup. I'm like, if it's not that, right?
Yeah, it's just, we just don't want to have that white cast to it from the zinc. It's it is a really popular product for us though. And as sunscreens go, like you can also, I mean, you have mineral block sunscreens. They're all going to have titanium and zinc for the most part, or one of the two. And then that's
standard and normal, the titanium and zinc.
Titanium and zinc.
But it's the oxybenzos.
Yeah, oxybenzoate and all those.
A little bit. Okay.
Exactly. Those are the chemical blocks. But yeah, this one, we use silicone to suspend the minerals, which actually helps them spread out really well. So that's one of the reasons you can't see the tint as much. And then it's also like naturally water resistant. And silicone,
nice.
You don't need to reapply quite as often. And a little bit easier.
Face and body kind of thing, right? Like, okay.
It can get a little pricey though if you're going to use this for the rest of the body areas, but definitely for face and neck, that's primarily where we use it.
Okay, I like it, and obviously should be putting on our face and neck and décolleté every day.
Absolutely,
right? Okay. I talked earlier today about on a YouTube that's going to be separately about vitamin D, which obviously you can get from the sun. But obviously sunscreen is very important. So I do remember someone telling me, they were like, just leave a tiny little spot that's the size of a quarter and then you'll end up getting some vitamin D absorption. I'm like, okay. But I mean, most of us are vitamin D deficient here because it's so sunny that we're covering our bodies up so we don't like burn outside constantly. True. Okay. So a lot of the products, and I think I went to y'all's website before and there was a pretty easy way to see the products that were considered pregnancy safe. I would say almost all of y'all's products are considered pregnancy safe. However, there are some that would want to be avoided in pregnancy just because of a few of the ingredients. So they're pretty clearly labeled on the website, right? So that a pregnant person can find the right ones. Absolutely. And really our entire line is pregnancy safe with the exception of 3 retinol products that all have retinol in the name. Actually, in the retinol section of the website, Ultimate Youth Restoring Serum does not say retinol, but that does contain retinol too. And there is a little disclaimer about that on the info page. Okay. But across the board, everything else will be fine. The products that do contain salicylic acid, I think those also are labeled as such, as like talk to a doctor. But yeah, the retinols are the main ones to watch out for. There is one additional product that's not a retinol that has a derivative of retinol in it. It's called the Brightening Renewal Lotion. And that is a product that does contain retinol palmitate. It's basically a derivative of retinol that's probably safe, but just we avoid it to stay on the safe side. When it's clearly labeled, which I think is really helpful versus quite a few other websites I've been to or places I've been looking, it's just not clear. And then you're kind of looking at the, 100 ingredients listed and you can't pronounce like 90 of those 100. And you're like, I'm just looking for the word retinol somewhere. So I like that it's clear. And then we also have a code for people to be able to use, right? Dr. Lexi 20. Yep. And what website, and I'll make sure include the link below too, but the website that they can go to kind of look at the products, what's the best place to go?
So just glowbiotics.com is our website. So just GLOW, so Glow Biotics. And then, so it's all concept of glowing skin and probiotics. So that's kind of our
Love it.
glowbiotics.com and Dr. Lexi 20, DRLEXI 20.
Love it. And I wanted to hear, so as people know, I'm in Phoenix. You live in Phoenix. Well, I say Phoenix, in the Phoenix area, right? So we're both around here. This product is made locally?
Sure is.
Can you tell us a little bit more like where and how? Because I love that as well, because I know it's being made here and I just think that that's fantastic.
Yeah. So a lot of our labs that actually produce the formulas, some are in Louisiana, some in Washington. We've done some here in Arizona. Our warehouse that we ship from is here in Arizona, and as well as our corporate offices and where we've worked. So as far as like the actual formulations themselves, though, those are typically made at different labs. Just wherever the best lab is typically where we're going to have it made. And some of the really, really neat formulas and peptides that we've gotten, you can only get one place. You can only get it if you go to this one specific lab in Louisiana and here. And hey, it's
I like it. I like it. And then can you give me a little bit more, you might know this part, I can't recall, but the background of when this started and why it was actually started to make sure that there weren't xenoestrogens included in the products?
Yeah. So our fearless leaders, I should introduce them. So David Watson and Christine Watson are our co-founders. David first started Biomedic back in the early 90s. Very successful, one of the first medical grade skincare lines. Before that, you didn't really see skincare at a dermatologist or plastic surgeon. It was really the introduction to that. So he was a pioneer in that skincare space. And then later did more of a retail concept with Philosophy Skincare. So that's kind of his background in the skincare world. His wife, Christine Watson, she was a buyer for Harrods in London. Really brought a lot of retail concepts to our space as far as skin feel and elegant look for the products. But she's also a 2-time breast cancer survivor herself. And she was behind a lot of the push to come out with a skincare line that could work on people that want results, but they're immunocompromised. So that could be somebody with cancer in their family. It could be, pregnancy and nursing. Anyone that has these different conditions that could result in more reactivity or more sensitivity to certain types of products. So really their minds coming together and putting together the brand, that was really how it all began.
I love it. And I love that you also mentioned the immunocompromised state. I think a lot of people forget that pregnancy in and of itself is an immunocompromised state. We are, when pregnant, more prone to infection. We're more prone to getting foodborne illnesses. I mean, anything and everything. We're more prone to diabetes because gestational diabetes occurs. Low platelets can occur. There's all these different things that it can occur. Wound healing can be, a little harder. All the skin changes that occur. The lungs are changing. Everything's changing, right? To make sure that someone can get this placenta, all the nutrients to grow this fetus. And so I find it absolutely fascinating that this is specifically geared toward that. And it just makes it a very safe place to go for knowing this product and not kind of having to do any guesswork. And I really enjoy that. And I know that the product is available online through y'all's website. And then you mentioned the word medical grade. And you and I talked about this before because I had a friend say, "Oh, I'm switching to all medical grade skincare products." And I was like, what does that mean that you're switching to all? And you gave me a little bit of history behind this. And I think that it would be nice for people to hear what you told me before, because I learned a lot from that conversation.
Oh, right on.
Yeah.
Well, yeah. So medical grade is kind of an arbitrary, I guess, marketing concept more than anything. It's we consider ourselves medical grade because we're sold primarily through dermatologists and plastic surgeons and medical run practices. I think the first 5 or 6 years that Globiotics was in business, we sold exclusively to under licensed physicians. And so you didn't have estheticians working with the products. You didn't have consumers could not purchase it through a website like they can now through Globiotics. And all of our main competitors were the same way. So at that time, the definition was pretty much medical grade is you have to go to your doctor to buy it. You cannot get it elsewhere. And then since that time, it's kind of evolved to be more of this is products that are recommended by doctors that are sold primarily through that state. But we also have an e-commerce platform through globiotics.com just like our other main competitors, they have their websites. I think you'd be hard pressed to find any product that's truly exclusively available through a physician's office now. Where we still have some products like chemical peels and things that you have to go to your provider for, but it's the whole industry changed significantly in the last like 5 or 6 years, where we've seen websites go up there, and so there's a lot of powerful medical grade products that are available like they haven't never been before. But it's also, that definition is really primarily about the science behind it. Is it clinically proven? Is it available through physicians? Do physicians promote you? That's how I understand it to be now.
Yeah, I love that, because it's good to know, because I think that my friends are like, well, I just found this online. It says it's medical grade. I'm like, is it? I don't know. But it's, it's kind of like what it used to be and what it is now and what's available, and just getting some information behind it too, which is, I think, always helpful. And I have noticed too, when I order things on, and I've had people in the hair care industry tell me that when you order certain things online, like through I want to say Amazon, but all I can think of is Amazon, because that's where I order from constantly. But if you order something that's not from the actual source, that you might get something that could be watered down, or it could be altered a little bit.
Yeah, and certainly in skincare, there's concerns about counterfeit products or people that are selling things that are expired. I mean, it's always best to go to the source and buy it directly from your physician, or globiotics.com if you're looking for our products in particular. But it's kind of, there's the e-commerce world has changed a lot, and it's constantly changing, and that's definitely complicated things quite a bit.
I know. We got to navigate it too. And that's the whole point of this too, is to try to figure out, who do you trust? How do you know the source is legitimate, and, all that kind of stuff, because there's so much out there. You got to know what's the right thing to actually trust.
Absolutely. And we have on our site, like, also a find a provider section too, where you can find a provider. And then there's also, of course, through the site, you can see as far as the efficacy of different products, and you can read a little bit more about specific ingredients and look up ingredients if you're curious about them. I know that's something we talked about a lot too.
Yeah. That's huge. I like that a lot, because for anybody listening who's heard me say this multiple times, do you know who Brene Brown is?
I know the name. I'm not familiar.
She's one of my favorite people in the world. I don't know if she knows this, and I always try to do this. Hi, Brene. If one day she might see it, and then I'm going to be super excited. But my favorite thing that she's ever written in any of her books, and that she said, is clear is kind, unclear is unkind. And so having all the information, having transparency on your website, knowing what you're studying, what you're looking at, what it does, right? So when I see this ingredient, I'm like, oh, it's to help this, and that's why it's there. Or why do I not want this one? Because I'm pregnant. Oh, that can have issues with this. Having the clarity behind all that is so nice, because it's just right there,
Except for thyroid function testing. You don't need that clarity.
You don't need that clarity. No. Only if you need to have it done, but it's not a blanket. Exactly. It's not a blanket screening. So, okay. So I think we have, at least I have, expanded a ton of my knowledge on skincare products and information. And I hope people watching and listening have too. And we've gone through kind of the things to avoid, the things that are generally considered safe, and the knowledge that you always have to talk to your provider before you proceed with anything. And it's always good to know that. Developing the skills of asking the questions, right? Like, when you find out you're pregnant, can I use the products I've been using? Do I need to switch? Anything like that. And you have the skills now to know what websites to go to. This is a great website too. You have the skill of knowing you have a coupon to use, Dr. Lexi 20, because it's 20% off, which is great. And I love the fact that hopefully people know a little bit more now how to navigate that website. And if you have any questions, you can always let me know. And I'm sure you guys are easy to reach the website too.
Yeah. Our CS at globiotics.com is always a good email, or also our phone numbers on there too.
Nice.
But yeah, we always field consumer questions and questions about safety for different products, and definitely here to help.
And then our big thing too is impact. So we want to have an impact on your pregnancy and make sure that you have the ability to advocate for yourself and your pregnancy. And this is fascinating. As I mentioned at the beginning, I feel like this is a space where everyone kind of punts to another person to answer the questions. And I feel very lucky and honored to have found a person that was able to fill the void of the questions that I had, and like take me to this space of, oh, you're the person. Like, you're literally the person that's bridging the gap between all of us providers that are like kicking the ball to the next person and like deflecting. So this is fantastic. And I wanted to, before I kind of sum up everything, which I guess I kind of did, any of these other things that you want to mention of what these are, just because they're pretty there and I want to take them all home with me?
Oh, well, they're yours. Now, so this one is one of our definitely top products. Advanced Vitamin C Brightening Serum is the name of it.
Okay.
So that's definitely for a lot of pregnant or nursing individuals. This has two different forms of vitamin C. Magnesium ascorbyl phosphate and ascorbyl glucoside are the two molecules. They're both really stable and they won't be as inflammatory as some other vitamin C's on the market. This also has that ingredient from oats that's soothing, the Sin Common. But yeah, very, very gentle vitamin C. And it's the kind of one that pregnancy safe type product. And certainly for helping with pigment as well as just an regular antioxidant. That's another one to mention.
And what's the big thing with vitamin C again? I always hear brightening, but what is it that vitamin C is doing for the skin?
So being an antioxidant, that antioxidant protection is one really big piece of it. But the part that's not talked about enough is how vital vitamin C is for collagen production.
Oh.
You cannot have collagen without vitamin C. It's like a prerequisite. So you have to have vitamin C. We have it, and this is our kind of target vitamin C product, but we also use vitamin C in a lot of other formulations. Even if it's only 1 or 2%, it just helps with that collagen synthesis. You need to have it. So that's the place I really see it the most.
I like it. Also, by the way, and I bought some sunscreen recently and had to send both of them back. The squirt bottle didn't work. And that's a huge thing. I think I knew someone who made makeup products for a large company or whatever, and the distribution was an issue because sometimes the squirt bottles don't work. I don't know if it's called a squirt bottle. Is that what you call it?
Well, we use airless pumps.
Oh, okay.
Nah, but yeah, there's squirt bottles. I mean, and you can always have malfunctions or that kind of thing.
Yeah,
too,
but y'all seem nice and substantial. I've just had some recently that they just don't work. And when you buy a product that has all the good stuff on the inside and you can't get it out, it's very frustrating. So I like that y'all's work.
Yeah, no, that definitely helps. And especially for a product like vitamin C, antioxidants, they're more vulnerable to oxidation from exposure to air. So if you buy a vitamin C in a dropper bottle, it sometimes turns yellow and crusty over time because it's the vitamin C's oxidizing itself and it's losing efficacy.
Okay.
So an airless pump like this is really nice to help keep the product safe and stable over time.
I love it. And then what is this one? This looks like is that an oil?
So that's actually the brightening and refining layering solution. So this is we sell it as the liquid form. It's in a bottle like this, just the liquid, or we also sell the probiotic instant resurfacing pads. So it's 5% lactic acid, 1% azelaic acid, and it's essentially going to be a way to deliver probiotics to the skin. So our really big probiotic concept, I'll go 30 seconds on that.
Yeah.
Probiotics, they stimulate a wound healing response from the skin. So there's two different ways that probiotics function. One is maintaining a balanced microbiome. So you want the good, healthy balance of good versus bad bacteria on our skin. We know that there's that ecosystem and we need to try to stack the deck in the favor of the good bacteria so you don't have acne and infections from imbalances. So that's one side. And then the other piece of it is probiotics stimulating our immune response. So improved cell turnover, more new cell growth, more collagen production. Your skin is thicker, happier, healthier with the presence of probiotics, and they directly stimulate that wound healing response that we're trying to turn on. If you look at skincare in general, medical skincare, there's a lot of things that are inflammatory that people do because that makes them look younger in the end. So think chemical peels, microneedling, lasers. These are all things that are beating up the skin, causing a wound. Your skin heals. That new cell growth is happening because you're recovering from that wound, and then you love your end result. Probiotics are kind of a shortcut where we're getting the wound healing response, but we're not causing the inflammation in the process. So you're still turning on that improvement for collagen production or more growth factor peptides, more new cell growth, but you're doing that without actual causing an injury and compromise the immune function of the skin and the barrier and all of that. So especially for somebody that's nursing or pregnant, I mean, being able to use a product with probiotics, those probiotics themselves bring you the results rather than causing an injury that you have to recover from.
Yeah.
So it's
that's fascinating.
Kind of a neat
That.
concept.
I've never done the microneedling or those things, but I've seen people that have, and it's usually for almost a week. Their face just looks beet red and they look like they're in pain. So
yeah, there's a lot of aggressive, both products and services that people get from their physicians. I mean, the question, I think we talked about it a lot. A lot of people that go for toxin and Botox and different kinds of different services, but they want to stop that during their pregnancy. A lot of people do, or they don't get as many of the same services, or may certainly stop their retinol or some of the more aggressive products.
Yeah.
but being able to continue the results and be able to continue their skincare goal, achieving their skincare goals with more safe ingredients like probiotics.
Yeah.
It's kind of where we like to step in.
Yeah. And I think too, that you make such a great point. If you're seeing a provider and they tell you you can use nothing on your skin, like you just have to use water and I don't know, soap or whatever, that is not the right answer. I mean, that's the big thing I think to take home from this is that you have options in a safe space. You don't have to give up trying to brighten your skin and wear sunscreen. No, you don't have to give up everything when you're pregnant. There are still options for you that are very safe that you can still continue. It's just trying to be in that space of finding the right person to ask the questions to as well.
Absolutely.
So, the other thing too, as a reminder that I always forget to say too, you can also go to my website, drlexihill.com, and you can click on patients in the upper right-hand corner and you can book a consult with me. So if ever you need to be in that space, because obviously this is going to be like for everyone to look at and talk about, and we're not giving direct medical advice here. We're just giving information for individuals, and always talk to your provider. But if you're in need of a consultation, you can go to my website and book a consult that way, which is kind of cool. The caveat to that is you need to be in a state in which I'm licensed. And those are all listed on the website too. We're almost up to 2025 now. So we're getting half of the US, which is not bad.
Huge.
Yeah. Getting there state by state, just knocking them down, man. So, well, this has been fantastic. Are there any other things that you wanted to share with us or talk to us about that we haven't gone through yet? I think we've talked about most of the things. I wanted to do sunscreen. I wanted to go through washes and basic day-to-day, and I wanted to talk about some acne stuff. I think we got the main ones. Were there any?
Yeah, I think that's the main points. I mean, we've got a lot of products to look at, and it'd be a lot more complicated if there was like a specific pregnancy only list that you can only see like 4 or 5 products. But for us, it's like pretty much our whole line except for a couple of retinols.
Yeah.
So it's that makes it a little bit easier. But for targeted concerns, I guess is the big thing. It's like if you're looking for acne or if you're looking for hyperpigmentation treatment or just something for fine lines and wrinkles, that's kind of point you through the navigation screens on the site. But yeah, I think we covered a lot of most of the main points.
And what he said is like, it's almost the opposite of what we normally hear. Usually it's like we have all these products and then the pregnant individuals get to go to this tiny part. For you, it's like we have all these products that are for everyone. And then the ones you shouldn't use are these tiny little areas, So it's perfect. I love it. And I love the story as to how everything started. And I love that there's a passion behind starting this product. And it was to be there for people that are in that immunocompromised state. I love it. Thank you for coming today.
Awesome. Thank you for having me.
I hope you guys have learned something today and really expanded your knowledge surrounding this topic, developed some skills, and seen the huge impact that you can have on your life and the life that you're creating. Again, I'm Dr. Lexi, wishing you a happy and healthy pregnancy.